Well, good morning, everyone. Welcome to Health Talk. I am Peter Christian, and John King will be joining us here in a moment. But we are honored to have with us in the studio from Community Medical Center, Dr. William Stratford. And I know that Dr. Stratford is basically world-renowned for the work that he does, and so many different aspects of what you do in your practice. But today we're here to talk about migraines. So can you tell us a little bit about the work you've been doing with first a little about yourself? How long have you been in Missoula, and how long have you been in practice, and what are your specialties?
Yeah, thank you, Peter. Good morning. I'm a medical doctor in Missoula. I've been here happily 44 years, practicing general psychiatry, but I'm board certified in psychiatry, neurology actually, but I do psychiatry, and I do forensic psychiatry, which is the medical legal aspect.
One of the reasons I remember you is because you have testified in some very high-profile trials.
I do a lot of work. I'm lucky to go around the country. It's always interesting. A lot of work. Always interesting.
Right.
So I've done that, and really today what I was here to talk to you about is migraines. I have always worked with depression and mood stabilization, and I've really found that that there's an entirely different spectrum of human beings out here in America that are really affected. It's the third most prevalent disease in America are headaches, and it's the sixth most disabling.
Now, are obviously all headaches aren't migraines?
Right, all headaches are not migraine. Although 18% of women suffer from migraine, 8% of men. There are other headaches that are called cluster headaches that are a little more common in men.
Right.
But the weight of headaches really enormous. Almost every 10 seconds somebody goes in an emergency room in the United States for that. The average costs $1,800 a shot.
Wow. Sorry. Go ahead, John.
Why is there this difference between men and women when it comes to migraine?
Good question. Don't know. It could be hormonal, but that may not be a sufficient answer.
Well, I actually know the answer.
Oh,
it's
yeah.
because boys and girls are different.
Is that right?
No extra charge.
Yeah,
for
I know.
that.
I need to get out of my books and just use common sense. Yeah.
Sorry, I couldn't resist.
Actually, the co-founder of the Declaration of Independence, Thomas Jefferson, couldn't do any work until the afternoon because he was a migraineur.
Wow.
And he used quinine bark off a tree in order to be able to function. So humans have struggled for thousands of years with this, and for many people, we've gone through the evolution of thinking that it was somehow vascular, so we now have the ergot drugs. We go to the emergency room, we get the Demerol. We have a lot of unfortunately narcotic addiction, which is a hot topic in the country. We have rebound headaches, but with migraine, what I learned is that with antidepressants, I can usually get a 75% response, but it takes weeks.
Wow.
With headaches, I actually got into this because my daughter had severe migraines, couldn't function in a master's program. I heard about this. It's actually not new. What we're doing is actually was at Harvard in 1908. And they figured out that they could.
That's even before I was born.
Are you sure?
And they figured out that they could inject lidocaine into a certain area of the nasal cavity, or use a cotton pledget and force lidocaine up. There was really a very unpleasant thing, but they could affect migraine. So the patent is really just a delivery device of something that's really way over 100 and something years old. So, yeah.
I was just really curious, something you had said earlier about antidepressants being used to treat migraines. And your background in psychology, is there a psychological element to migraines that isn't there in a normal headache or a traditional headache?
Typically not. I think you have a primary migraine, but the literature seems to say that about maybe 30% of migraine people suffer from secondary depression and anxiety. And so much of that is because of the load, the migraine load. You're spending days and 4 to 72 hours, with a headache that comes on. And most people know as you have some visual determinations. You have one-sided headache. It's often worse. You can't stand the light. You isolate.
Could there be a negative feedback loop where The
Like
initial headache causes you to be
Yeah.
kind of depressed and in stress.
Yeah, which
and
comes
then the
first,
stress
the chicken
makes,
or the egg thing? Yeah.
makes the headache
Yeah.
continue.
Yeah, but it's more neurologic.
Okay.
You know, the first of all is the neurologic. The second of all, you know, I looked up here the cost to the employer per year is like something 2,450. But if you have somebody that has 15 or more headaches a month, which is fairly common, it runs up to 7,100 per year just for the employer. But you can see it's almost a $20 billion cost, and over 2,500 per month out of pocket. So the thing that we've come up with is really just using an old procedure with a very safe drug. Xylocaine, everybody's had that when they've had stitches. Totally safe. You can use it in pregnant women. You can use it in children down to the age of 12, and 10% of migraineurs are under 12.
How is it delivered?
Okay, and that's the key to really our success. Is delivered. It actually just is a soft, like almost nasal spray that goes up the nose, doesn't hurt, doesn't cause any pain, doesn't go in the skin, and it's delivered because we used to think that headaches, migraine headaches, were primarily because of nerves, because of arteries and veins, and really that's been disproven. The new drugs that'll be out in 4 or 5 years have really recognized that there's an actual tiny ganglion, a series of cells that are really at the top of the nose in every human being. And that's where all the pain fibers for the brain go through this little tiny computer chip and up over into the brain. So when a migraine, it fires this up and you get all of this element going. And so what happens with what we do with is just the xylocaine. We just put xylocaine in there, anesthetize the little computer chip, reboot it, and then people can be pain-free. So, you know, how much does it work? Well, 74% of people will be pain-free totally. Probably up 16 to 18% will have a 50% reduction.
Is this something like a diabetic drug, like a pump that would continuously do it, or is something that you just self administer, or what?
It would have to be with a practitioner. You know,
Okay.
you have it done in an office. It only takes probably 5 minutes. Once you've discussed it, you just put a couple of cc's on each side, and you just wait. And everybody's anatomy is the same. It doesn't hurt. And then 6% of people it doesn't work at all. But the majority of the people it will help, and it can go for weeks to months of benefit.
I'm kind of the odd man out here. I've never had a migraine. I've never watched my parents have migraines. I have no idea what this world is like, other than that people that suffer from it act like they're in extreme agony, and I can't tell anything that's going on. Is there a genetic aspect to migraines?
There is. If one parent has migraines, a 40% chance the child offspring will have a migraine. If both parents are migraineurs, there's a 90% chance.
Wow.
So it does run in families. It can be aggravated. It's primarily a neurologic disease. It's not psychological. It's neurological. But it can be made worse by triggers. Stress, pressure, economics issues, carrying the weight of a family, working. These are mostly women who can't work.
Do these symptoms peak in election years?
In this election year, it has to peak.
And with that, we got to take a break. 721-1290 is our number. If you'd like to talk with Dr. William Stratford, if you have migraines, and you want to hear more about this amazing treatment, and this is the first time hearing about it, 721-1290 is our number. We would love to take your phone calls, and we'll be right back in a moment. All right, we are back on Talkback, and we really haven't had a chance to ask Dr. Stratford if Talkback could be a sometimes cause of migraine headaches.
It's a salve. It's an outlet.
Depends on your show.
We often describe ourselves as being highly cathartic. So,
Very good.
well, anyway,
I wanted to touch on something you had mentioned earlier. You said it's not psychological; it's neurological.
Right.
Can you go into a little bit more detail about what you mean there?
Sure, and yet it's certainly the chicken and the egg. It's neurologic. It's not vascular. It's thought to be neurologic, and that's where the real effort and the real money's being spent for the future. And the other really important thing to talk about is most of the drugs and availability in the emergency rooms are to treat an existing headache. Just stop it. What we're working with is not only stopping it, but the real key is, can you prevent them?
Well, when you say neurologic, are we talking about electricity moving through my brain at an improper timing or going the wrong route? Or are we talking about brain juices? I have no idea.
Brain juices in a way. All of us have nerves that come out of certain places, almost exactly the same in all of us, and they run through a circuit box, just like we look at the wiring of our house or barn. And this circuit box for the brain, for the surface of the brain, is right up at the top of the nose. It's called the SPG ganglia. So a reader, a listener could look up SPG block, and they would be able to see that this is the little tiny area where the nerves come through, and we're really blocking that and rebooting it, and that's what stops the pain fibers.
Okay, so strap on those headphones there, Doctor. We're gonna get Mitch on the line here in just a moment. Okay, Mitch, you're on with Dr. Stratford. Go ahead. What's your question?
Good morning. This worked out pretty well. My fiance was working about 7 months ago and got conked on the head while she was at work, and she's had a headache ever since. And she's actually home today. We're trying to figure out a way for her to get better.
Sure. Well, thanks, Mitch, for the call. Yeah, the first concern that a neurologist or any physician would have is there something else physically causing this kind of headache? So
could that be a concussion?
A concussion.
She was diagnosed with a concussion.
A concussion, can lead to post-concussive headaches. TBI is a potential. And so anytime somebody presents with head trauma, or this is the first headache they've ever had, the worst headache they've ever had, or it's a different headache than they've ever had, I would refer them to their family physician to work it up in case there's something wrong inside the brain.
He indicated that it was in her head, that this was mental. And she's actually got a soft spot on her skull that you can feel. It's very painful.
Yeah, the post-concussive symptoms are very real, and they can last months, and you have to just make sure that there's no traumatic issue within the brain. So oftentimes a CAT scan is useful in that care. But it would be, under those circumstances, I would really be careful, because a recurrent headache could be a migraine, because there's chronic headaches, there's cluster headaches, there's trigeminal neuralgia. But something that's like this that follows a head injury, not typically migraine, I'd be looking for other causes and other kinds of treatment.
Thank you.
Thanks, Mitch.
Yes, sir.
Hey, good luck to you.
Question from Barry that Peter has a lot of personal relation with. This is he wanted to know about ocular migraines.
Ocular migraine often is a variant of migraine. There are 18 to 20 different descriptions of different forms of migraine, and ocular migraine. Many people have an aura, which is a visual change where they are light sensitive and they need to be quiet. They need to be in a dark room. Ocular migraine can be a variant where you get visual cutouts, or you get zigzags, or you get stars, or the visual. Actually, you can lose vision transiently, and then an ocular migraine is still in the migraine category. So then it's, how often does that happen? If it's a episodic, 50-cent doctor word, it's fewer than 15 a month. Chronic is over 15.
So silly me, I thought all migraines were pain in the brain. Apparently there's lots of other types. You said like some 20 different types of migraine. What other stuff can a migraine make happen to you?
Well, it's certainly the typical migraine or cluster headache. There's different kinds of headaches, but the migraine sufferer, they know what they feel. They have a need to withdraw. They can't really assume the burden of what they have to do every day socially, and they need to be quiet. They need to their appetite's down. They use their medicine, or they don't, or they contemplate who's going to take care of their children today, how are they going to get to work, if at all.
So like just introversion.
Well,
it's a sign of migraine.
It's isolation in response to pain, and migraineurs know, they live by the clock of knowing when the pain is going to happen. Is it tomorrow? Is it next week? And so
they live in fear.
They live in fear, and they live counting their pills. That this is expensive. It costs $2,500 a year on the average for just the medicine. So they live in fear of their disease. And the other thing I've really learned about it is that they're very quiet. They suffer very much quietly. They don't over-report. 60% of them don't even go to a doctor.
You had mentioned earlier it's the third most common disease or something like that.
Third,
How many people, like 1 out of 10 sort of scenario, are affected by migraines?
16 out of 100.
16 out of 100, so
Yeah.
more than 10%.
More than 10%, right. 8% have cluster, 16% of women, up to 10%. It can actually now go down. They've known now that children can have migraines. So for this procedure, we've never had any litigation, no problems with safety, but 12 would be the lowest limit.
Tell you what, we're up against a break. When we come back, I want you to be very specific about for folks who've been suffering with migraine. I'll bet they've got the radio turned up really loud when you started talking about a way to. Is there a way proactively to prevent more migraines from happening? So can we talk about that when we come back?
Yes, sir.
All right, and we have lines open. If you want to visit with Dr. William Stratford, lines are open right now. It's 721-1290. We'll be right back. Okay, we are back, and time is rapidly escaping with Dr. William Stratford from Community Medical Center. We're talking about migraines, and I specifically asked you, we need to be real specific about, how this treatment is available. Is it really expensive, and can it actually be proactive in preventing migraines?
Okay, great question. Let me take the last one first. Okay. That's the gold standard, is if it can be preventive. So it can be used in between headaches, so you don't have to have a headache. In between headaches, and what we've found is the more frequently you use it, the longer the prevention period is. So we're finding it works both ways. It stops the headache, but it prevents it, and with recurrence, it goes that way. How expensive is it? Manida, that I work with, has been working with insurance companies around town, and that's available. It typically runs $500 to $600, but it's usually Manida has worked with most of the ongoing insurance companies. Most of it's covered by insurance. It's covered totally by Medicaid.
Right.
Totally covered. And so it's not a pill, it's not a patch, it's not an injection. It's just a solution like a nasal spray. There are no side effects. We have no disability, no litigation. It can be used in pregnant women and children down to the age of 12.
Wow.
We got a question from Bill. He says, please post Dr. Stratford's contact information. Our daughter suffers from migraines, and we have run the gauntlet on treatments.
Sure. Well, it would be yourmigrainecare.com is our website, and it has a contact number on it. And that we work with the Manida people, and they have been fabulous as far as helping us with insurance and structure, and we could not be where we are without them.
Now, Dr. Stratford, when you first began to work with this, were you a little bit skeptical as to something that would be so evidently so easy to apply and so common sense would be so effective?
I was shocked. I did this with my daughter. She got 9 months of headache relief, functioned in school again. And while I normally work with antidepressants and talk therapy, it takes weeks and weeks and weeks. This is immediate. And so in the office, the kind of selfish part of this is I can help with one person at a time.
Right.
With headache clinics and urgent cares, I can help hundreds of people at a time. So it's a total win-win for everybody, but they also get headache relief.
Are you instructing other physicians in like Now Cares and things how to apply this?
Sure. We have a contract with up to 11,000 urgent cares, and so we have instructional training 24/7, answering questions, trying to get them set up, trying to help teach them how to do it. It's very easy to do. It's easy, even anybody in the medical profession can find this to be the easiest procedure they've ever done.
Fantastic. All right, so real quickly, we have like 30 seconds left in the program. So where do we go? Who do we call?
Yourmigrainecare.com will take you right to our phone number. That will take us right to Manida. They'll find out if your insurance qualifies you. If you need more information, they'll get that question to us. We'll provide that to you. You can, and we'll provide you other websites, other literature reviews, and this has been written about for over 100 years.
Fantastic. It's a pleasure meeting you and having you on the show. We really appreciate it, sir.
Glad to be here.
All
Thanks
right.
for the time.
You bet. That's going to do it for Health Talk for today. Extremely informative, and we'll be back.